Bring in Dr. Ombajo, who I'll first be speaking with. She's the infectious disease specialist at the University of Nairobi and at the Kenyatta National Hospital. Dr. Ombajo, busy day, but thank you for making time for us. Let me first begin by getting an understanding on our positivity rate of 22.1%, the highest in a long time, if ever, and it's been like this for the last 2 days. Why do you think we're seeing this now, Dr.
Good evening, Wahiga. I hope you can hear me well. Thank you for having me on your show. It's true that the positivity rate has gone up, and this is a trend that we've been seeing over the last few weeks. Within hospitals, we started seeing this trend a little earlier, but it's become even more pronounced over the last few weeks. And what a high positivity rate means is that if it's at 22%, for example, it's that every time you test maybe 4 to 5 people, one of them is going to be positive for COVID. And basically what that means for us is that there's a lot of spread of COVID in the community, what we call community transmission, which means in whichever section you are, there are likely to be people who may be positive and who may be transmitting to others within the community. So that is a worrying trend. It means we have more people who are sick, more people who require to be admitted into the hospitals, and this is a time when we're also likely to see more people dying from severe disease.
Dr. Do we understand more about the virus now? For example, some had predicted that after the December holidays we would see what we're seeing now. Others had said in February maybe, after children went back to school in January. Why now? Can we tell why?
So that's something that baffles us as well. It doesn't seem to follow all the rules that you expect of many infectious diseases. Indeed, around December, at the time when a lot of people were moving around the country, we thought that we'd see a slight spike, but we didn't see a significant spike at the time. The other concern was around the time schools opened, and again, we seem to have weathered that period fairly well. Over the last few weeks, however, we've noted that there's been a lot of people complaining of colds and coughs within schools, outside of schools, and in the community, and this is probably the time when we started seeing a large spike. So why are we seeing it now? One could really be that because we've had very few cases over the last few months, people have relaxed on some of the measures. As we've been reporting earlier, mask wearing and hygiene practices have gone down. The other concern that we always have is that could we have a new strain in the country, because that then may explain slightly more spread than we have seen in the past.
What can you tell us, Dr. And thank you for helping us try to understand this a bit more. What can you tell us about this third wave? Is it a new strain? Is it a new variant? What are the common symptoms? What are you observing in the wards?
So other than having more people who are sick, what we're seeing now is very similar to what we've seen in the past. Most people present with coughs, features of a sore throat. Some people may have some chest pain and difficulty breathing, especially if they have more severe disease. So that has not significantly changed. It's only that now we have more people presenting with that. I guess the other question you asked was, is it a new variant? So maybe just to go back to what these variants were. So when we talk about a new variant, it's that the virus changes its characteristics from time to time, and this is usually a continuous process, and many of these variants are really of not much consequence, but occasionally you have certain changes that makes the virus a little more likely to be transmitted or a little more likely to cause more severe disease, and those are what we call the variants of concern, and they're of concern because they may spread a little faster or cause more severe disease. So some of those variants have been seen in different parts of the world. So you've had reports of variants in the UK that were about 50% more transmissible or spread a little faster. We've also heard of the South African variant, again, which caused fairly large outbreaks. And over time, we've sort of seen a lot more outbreaks coming north away from South Africa, and the concern has always been, is this South African variant spreading further north? So the only way to be sure that you have a variant is when we have lab testing that tells us that the virus we're seeing has changed a little, and that requires the capacity to really look at the gene of this virus and tell us that there are certain changes that we're seeing in the gene that tells us that they are variants. Unfortunately for us in the country, our our capacity to do this has not been very high. So for that reason, we're sort of not keeping the pace with the spread of the virus. We know that there have been a few cases that have been identified by the team that's doing this sequencing based at the Kemrick-Ilife, and they identified a few of the South African variant and a few of the UK variant. So at this point, the suspicion is that we may have some of this variant circulating, may partially explain why we're seeing such a large spread of disease, but we do not have the exact figures as at this point.
Dr. Ombajo, I'm getting so many questions. Let me try slip one in because I have to do a few more stories, and I hope you'll still be on standby when I do come back to you with more questions. Many are concerned about the high rate of deaths this time round. The loss of life of one person is too much already, and the numbers we've seen over the last couple of days are alarming. What is different about this third wave? We've had talk of the virus being able to move straight from the nostril to the throat directly into the lungs in a very short period of time. Do you understand why it is leading to such a fast rate of loss of life?
So one of the things you have to understand is that if death is a percentage of the number of people who are sick, it means if you have more people who are sick, you're likely to see more deaths than a time when you have fewer people who are sick. So at this point, it's not, we don't have very clear indications that we truly have a higher death rate, but the numbers are higher because the number of people who are getting sick is higher. The other thing that we always have to be careful about is that when very many people are sick and we start to get hospitals getting full and ICUs getting full, that it means a time comes when the people who need care, especially in the critical care setting in ICUs, are not able to get that space. So it's always important that as we think about the outbreak, we make sure that we're not overwhelming the hospital space, because then people die both of COVID and also of other conditions that should have been treated, but you're not able to treat them because the healthcare capacity is struggling. So one, the higher deaths you're seeing is a reflection of higher number of infections in the community, higher number of people getting sick, and also as time goes on and hospitals get full, then we may also have people who are unable to access care.
Dr. I certainly hope your answers are bringing some understanding to our audience tonight.